So welcome everyone to Cosmo Malayali. This is our second season and this is the second episode of the second season. So far we have done career guidances on professions in medicine and law. This time we are doing another career guidance episode on dentistry. So for this reason, so that it is useful for and it can be shared to as much as people, what we have done is we have done the entire episode in English. So please make sure that you can share with your friends and family. In this episode, I'm going to let Savita introduce our special guest. Over to you, Savita.
Thank you, Nitin, and welcome all of you. We have a special guest today, Dr. Roshith Valiyamannil. He is a very accomplished dentist with his 26 years of experience in dentistry. He has a master's in oral surgery, MFDS from Royal College of Surgeons, England, and he was trained in placing dental implants at the Royal College, London, PG implants from Cambridge University. He's sedation trained, and it goes on. He has a broad range of experience in primary and secondary care in India, Dubai, and in UK. Currently, he has his own practice in Kent. However, with his keen interest in teaching, he has been a mentor for his junior colleagues and runs an implant course which seems to be oversubscribed. A great communicator, Dr. Roshith is actively involved in helping overseas dentists to come to UK and pursue their career. He has done various international seminars for recruitment and pursuing young dentists' career in the UK. I'm a dentist myself, and when Nitin and I decided on this topic, my first choice to bring in a guest was my friend Roshith here. So a warm welcome, Roshith, to our Cosmo Malayali show.
Thank you. Actually, thank you, Savita and Nitin, for having me and choosing me as the presenter today. I have done few seminars on getting the overseas people, how your pathway will be in the UK, how you get the registration, how you'll be able to work here.
So we've got a lot of questions lined up here. So my first question to you is, could you give us a clarity on the current situation of dentistry as a profession in UK?
There is a lot of shortage of dentists in the UK at the moment. They are finding it very difficult and extremely big shortage of dentists at the moment. It could change. So yeah, that's the situation at the moment.
Current situation here. So for someone who is coming from India, who's done their the bachelor's degree, the BDS from India, what sort of pathways are there so that they can come and work here in the UK as a dentist?
Okay, the most important thing is to get registered permanently with the GDC, which is General Dental Council. In order to get the permanent registration, you have to do an examination called Overseas Registration Examination, or ORE. Or you can actually also get another examination, which is called Licentiate Examination or LDS examination by the Royal College of Surgeons of England. Now, that's the only way to work as a dentist in the UK. Okay, there are other paths which you can do as we can actually register. We used to, you can register as a therapist or a hygienist, or you can work as the trainee dental nurse. Or you also have other pathways, like you can come as a student here to work, to come here. And then while you're here, you can do some other things, which will actually come in the further discussion.
Yeah. Talking about the ORE and the LDS, when I came here in 2000, I did the IQE before I came in, and which was not existing at the moment. So you mentioned about the ORE and the LDS. So what's the difference between these two? Is there any advantage in doing one of them, or what's the difference?
There is advantage and disadvantage of doing an ORE as well as an LDS. Actually, LDS, as I said, ORE, as I said, is conducted by the GDC themselves, whereas LDS is conducted by the Royal College of Surgeons of England. Now, coming to the registration, the LDS is slightly better, easier to get into, because you can actually register straight away for the examination, whereas in the ORE, the registration process is a bit tedious, because you need to submit a lot of paperwork to get registered first before applying for the ORE. there are people waiting at the moment for a few months to get even registered to apply for ORI. So that is a bit of a tedious work. Regarding the examination itself, the ORI part 1, the part 1 is actually a manual examination. So you have to come to UK to write the examination in ORI, whereas the part 1 of the LDS is actually an online examination. So you can actually sit in India and do the examination, whereas you still have to come for the part B or the second part or third part of LDS to UK. Regarding the parts of the examination, there are ORI is in 2 parts. The LDS in 3 parts.
3 parts, yeah.
You get a degree when you finish LDS RCS, whereas you don't have a degree to write behind your name in ORI examination. The LDS, the downside on the LDS degree is actually you have to subscribe this every year. There's a subscription fee.
That means with the LDS, you will have to pay the subscription to the Royal College. You have to pay the subscription to the GDC in order to maintain your registration, right?
That's right. So there are good and bad points on each of them. So which one is the best? Do your own research.
Decide.
Okay. So the other question is, like, if you are planning to come and work here in the UK as a dentist, what sort of work experiences or like courses, like, or do you do an MDS or do you do a specialization in implants or oral surgery in India? So that that can be useful in the UK. Is there anything like that?
According to me, if you have aspiring to come to UK, best is to come as soon as possible without wasting money and time doing a BDS or BDS, obviously. MDS there. Your MDS, with that MDS in India, you won't be able to work that particular specialty here in the UK. You can do the post-graduation while after you come here. The main concentration is get to the registration, the permanent registration by the GDC, by LDS or ORI. So once you get in there, then you can think about, improving your career here. Planning straight away, concentrate on becoming.
It's more streamlined if you come in early, isn't it?
Exactly.
Okay.
You mentioned earlier about different pathways of coming in here and working as within the dental industry. So, what's the current situation of overseas dentists coming in as working as hygienists and therapists? Because I know so many people who are working as hygienists and therapists. Some are happy, some are not. So, what's the current scenario?
Okay, this hygienist and therapist route has been open since 2017. But unfortunately, the pathway has closed since March 2023, which is just last month. So you can't register as a hygienist or a therapist anymore if you're an overseas dentist. You can come here as a trainee dental nurse, and then you can work there. But it's very difficult to get that visa.
So what about candidates who are they've submitted the paperwork for the hygienist therapist? I know it closed in March, but say somebody who has submitted it 6 months ago, will they have an opportunity?
Sure, whoever is applied for it will get their registration, and by the time registration, which will be a year later.
Roshith, so basically, once you're in the UK, you come from India, you've got to work as a dentist in the UK. What sort of postgraduate courses would you suggest? Now, I can take this in 2 ways. Like, there are people who come and stay here for the rest of their career in the UK, and there may be people who work here for some time but then go back to India. So, in these 2 groups of people, what sort of career progression postgraduate courses would you suggest?
One thing I always tell everybody actually is with any post-graduation you're planning to do it in the UK, you won't be able to work unless you are registered permanently with the GDC, which I've told you. But the courses, there are lots of courses, lots of MSCs. The only problem with that, as I said, unless you are registered here as a permanent dentist, you won't be able to apply. And there are other courses like public health, dental public health, and other
non-clinical
clinical ones,
courses,
exactly. Courses. Again, this is my honest opinion, is actually you can come just to be here, just take a non-clinical subjects so that you're here. Then while you're doing, you can actually do your, and then you can, and then work.
Definitely, because non-clinical courses will definitely, the fees will be much lesser compared to clinical courses, isn't it? So in order just to come in as a student, it's probably easier and cheaper for you to go in for a non-clinical course.
That's right.
Isn't it?
Okay. So, sorry, are there any particular courses or experiences would you suggest if you're planning to go back to India?
If you're planning to go back to India, and if you can afford some of the very good courses, which is MSc in implants, MSc in restorative, MSc in all the fields of dentistry are available. It is very costly, especially for the overseas candidate. One more thing I tell you, one of the pathway you can actually come here is by doing a program from the UCLan University, 18-month program. If you're an overseas dentist, you can do that. And then GDC have still not approved it, but they are 100% going to approve it within like few months' time. So you can do that. It's a bit costly. It's around about £66,000. But my dentist is, exactly.
£66,000?
Right. Okay.
Applications. You know how many applications were there? More than 28,000 applications were.
Oh my goodness.
For 100 seats.
Okay.
So that's. But that is another way of doing it. And also the other news is that there are a few other universities opening up similar kind of diplomas in the UK and probably in the overseas as well, maybe, but definitely in the UK.
Can I make a comment at this point? So certainly, if the capital investment is £66,000 and if there are 24,000 people applying for it, I'm sure there must be some good objective behind it.
Once someone's done a course, and I've heard of this post-study visa. So what's the status of this post-study visa?
Okay, post-study visa at the current time, it is 2 years if you're doing a course which is 12 months or maybe more than that. Okay. Now, there is a catch on it as well. You have to finish the course and then you have to get the approval from the university to apply for this particular 2 years extended visa. So that is available at the moment, and also you can bring in your spouse, and the spouse can work full time. Now the problem is, what I heard is they're gonna change this visa status, because one, they won't be allowed to bring in the spouse. Well, you can bring in the spouse, but the spouse can't work. And the second most, you can't stay back more than 3 months or something like that.
So obviously you need IELTS to start with, and because that's everywhere, isn't it? Like if you're in medicine or like dentistry. So what are the ideal scores for IELTS testing in order to work in this country? Are there any exemptions to it? Like if you come through another route, will there be exemptions?
The score should be 7 overall and 6.5 minimum, all the sections in academic. There is a very good exemption if you've done your degree within the last 3 years, and if the degree is done in English, which is most of the Indian universities have done in English anyway, so you can get a for that. So
okay.
Again, Roshith, in your opinion, what do you think about life as a dentist in UK? Obviously, I know how it is about the work-life balance and everything, but in your opinion, what do you think?
I've been working here 18 years, settled here, but I think 9 to 5 job, you got a 1 hour in between lunch break, and then Saturdays and Sundays, you can be at home and you can plan your holiday things together. Very, very good. There's no question about it.
The work-life balance is better, isn't it?
It's better, actually, because you can actually choose the number of days you want to work. It's not compulsorily you've got to work 5 days a week, or, I work 3 days a week. So, and I've got other passions to pursue. So, it's
like what
quite
we're doing
a good life. True. That's true. But because I'm not saying I used to work only 3 days a week, but in my early career days, I used to work 6 days a week. So there were times when I was working all the time, but you can afford to make it better eventually.
So, Roshith, we did mention briefly about the financial implications of getting involved in dentistry. So, for someone who comes from India for the first time, what basic financial commitments are they looking at? Or what financial burden of getting established in here in the UK before you actually start your work and get earn the wages actually?
If you're, it depends on what sort of pathway you are planning to come here. So if you're coming through the student pathway, which is the most common, one of the common, you come here to study as a student. While you're studying, you plan your ORE or the exams, and then you just work here as a dentist.
Yeah.
The cost for the particular course depends on, again, from 10 lakhs to 25 to up to 66 lakhs. That depends on which course you wanted to go ahead.
Course, yeah. Mm-hmm.
So you can be in shared accommodation, which we all have gone through. And things, you're looking around about 1,000 to 1,500 maximum monthly. If you have spouse and everything, it will be more than £2,000.
And I'm sure there are different forums where they can get support for cost-cutting tips and, from other candidates who've been here already. And I'm sure it's a close network, isn't it? Once somebody will know the other person who's been here, and then they'll actually know exactly what to do once you land in this country, isn't it? See, when you come in as a student or in any other capacity, when you come into this country, initially there will be days where you will struggle and there's going to be emotional issues. So are there any support organizations for overseas dentists, like regarding mental health, financial support, housing advice, transport, things like that?
There are organizations, AID UK, there's an association. I used to work in the Association of Dentists in the UK, and the dentists in the UK. IDA UK, there is BDA, and financial mental support. Yes, there are, which I give you some link.
No, I was just generally asking about any sort of support, advice centers and things like that.
Also very helpful Facebook groups when you are planning. So that's one thing I always, there are, or a part one Facebook group, VT dentists, the therapist group. There are lots and lots of whatever you wanted to type in. There are lots of groups which you can get into, and there are a lot of good, very, very good dentists who can actually really help you in those groups.
Yeah, that's true.
What do you think, Roshith? What do you think about the future of dentistry in this country and the future of dentists as a profession in this country? And do you have any specific advice for people or prospective dentists who wants to come and work in this country?
The future will be a lot of Indian dentists will be working in this country.
Right. Okay. Because of this episode.
With this episode, and there's a lot of people who wanted to come here, so there will be a lot of in this coming regarding the dentistry as such. The future is all digital dentistry. Everything is moving very fast and thick, and things are moving in the digital way. Things what we used to do years ago, we don't do it anymore. So it is very spaced at the moment, which is actually the very exciting time of dentistry. If you really want to.
Absolutely, you talked about digital dentistry. I have forgotten the time when I've seen a hard copy X-ray. I don't think I can interpret a hard copy X-ray now. And also now we've kind of stopped taking impressions. We are doing scanning these days. So, it's ever changing.
So yeah, that is in place at the moment. And one of the, which I've earlier mentioned, one of the things going to be really, there is something very exciting in the pipeline which GDC is bringing, which I am not 100% sure, so I don't want to tell anything, but I think there is some good news. I'm sure looks like there is a lot of good news for people who
that's very positive.
Keep updating yourself in the UK forums.
Yeah, for the information, for the updates, they can look at, who wants to look at it can look at the Dental Council website. Yeah?
websites.
Okay, that's good.
Yeah. So wonderful. So on a very positive note, I'd like to wind up this interview. And I hope for our viewers, it's been helpful for the ones who are already here and also for those who are looking to come over to UK. Please check out our links given in the description box for all the useful contacts. And a very, very big thank you to my friend Roshith here for taking his valuable time off his busy schedule. And I'll hand over to Nitin for, to conclude the show here.
Sure. So thank you, Roshith, for being part of this show. It was a pleasure to have you on this program. And to the listeners and the viewers, please do share this episode, because we have specifically done it in English, so you can share it with anyone who knows and reads and writes and speaks English. So thank you once again, and we wish you everyone all the best.
Thank you. Thank you again.
Thank you.
Bye bye.